Well, everything will depend on her age. If the patient is young, we normally recommend undergoing IUI, which means intrauterine insemination with a sperm donor. She can also undergo IVF, in vitro fertilization, and of course we also offer egg donation plus a sperm donor. In also some patients, it's also possible to do what we call embryo adoption. So the patient may adopt an embryo that has been previously created. Of course, everything will depend on the technique the patient is using. So if we are talking about intrauterine insemination, we just need to give a small amount of medication, normally to make one follicle or even 2 follicles grow in the patient's ovaries. Then when the follicles are ready to ovulate, we prepare the sperm sample at the laboratory to introduce a small amount of that sample in the uterus. However, if we are talking about IVF, the procedure is more complicated in terms of first, we need to stimulate the patient's ovaries. Then we need to retrieve those eggs that will be fertilized at the laboratory with the donor's sperm sample. And then we wait for 5 days to check how the embryos develop. Depending on the last decision of the patient in terms of checking the embryos before transferring them, the patient will need to do the embryo transfer, or if she decides to check the embryos before doing the embryo transfer, we won't do the embryo transfer at that moment, and the embryos will be checked first, and then if there are healthy embryos to transfer, we will do the embryo transfer afterwards. However, and finally, if we are talking about embryo adoption or egg donation treatment, the patient doesn't need to have the ovaries stimulated. We will just do a preparation of the uterus with the aim of having that uterus in the best conditions. Then the egg donor, in case she's undergoing an egg donation treatment, will do the ovarian stimulation. As soon as we have the eggs and the embryos ready, the patient will undergo the embryo transfer. So it's a much easier treatment for them. Well, according to the Spanish reproduction law, all donors, including male and female donors, should look like the patient. So we look for the most suitable donor for each patient. We do the selection in 2 different steps. In the first one, we consider the blood type, skin color, hair color, eye color, less like the most general characteristics. And then after having selected the most suitable donors, we use a special technology called PhenoMatch that will do a facial biometry in terms of finding the most suitable donor for each patient and the perfect match. Well, everything will depend on the kind of treatment the patient is undergoing. If the patient is using her eggs, of course, the baby will be more similar to the patient. If the patient is undergoing a different treatment, of course, we will also try to find the perfect donor for each patient, but it will be a different treatment. And of course, the chances of having a very similar baby could be decreased because of that. But in the end, as I mentioned, first, we try to do our best in finding the best donor for each patient. And apart from that, that's something which is called epigenetics, that are the small changes the DNA may have in the patient's uterus that can also make that the baby could be also quite similar to her mother. So in the end, there are different biological processes by which the baby can be similar to the mother. Well, it's true that according to our data, I would say that it's day by day more frequent to find patients that decide to become mothers on their own. And I would say that maybe in the last year we have seen a slight increase in that kind of treatments.